and we're going to be talking about dental health and the cycles. And there are two types of dental disease. There's tooth decay and periodontal disease. And at the first sign, the incipient, there's initially no sign, and the patient brushes and flosses. And then there's moderate decay, where the patient feels a hole. And then the biological symptoms, the next stage is when the tooth fractures and there's deep cavity, pain, and swelling. And periodontal disease involves the osseous and the surrounding tissue and the bone. And the signs are calculus and mineral deposits around the teeth, and that's full of bacteria. The symptoms are inflammation, red tissue, body reaction, and it dissolves the bone. The biological symptoms of the alveolar bone abscesses, and that becomes anaerobic. Once inside the tooth and gums, then the body's very robust reaction to inflammation. If the body's unable to rid, then it will wall off the inflammation. The biological pathways, this is really important, of acute dental abscess, the bacteria, the FBS and the AGS enters the body that would normally just go right through. It enters as pain and swelling, and it can be odontogenic on the side of the neck where the patient can't breathe, and tracheotomy may be needed, and it can also the metatinsel facial tissue, and that's the abscess that continues even with a prescription like clindamycin. Sadly, patients can die because of the septus in the blood and the organ failure, like kidney failure. High at risk are males and the inhaling any of the pus or exudate, diabetic patient, elderly patient, and pediatric patient. Recommendation is surgical intervention and prevention. Okay, the psychosocial factors of smiling are embarrassment. Social anxiety starts with cross-cultural problems, and this can be solved by positive emotional expressions. Effects of anxiety and psychophilosophical emotional response are environmental risks for unhealthy behaviors and psychobiological illnesses later in life. The meta-analytic psychological intervention shows positive outcomes of the immune system, which include wound healing and relaxation training. The psychocognitive effects of smiling supports what we perceive this smile as in communication as being polite, embarrassed, or amused. And we can also portray this characteristics in our eyes when those become involved using facial muscles. An oral surgery patient may be concerned with altered facial appearance or function, which may impact the psychosocial factor of the smile, speech, salivation, eating, eyes, nose, and the patient's self-esteem. Therefore, treatment of choice includes questionnaires and psychometric analysis in order to produce external supportive validation. The link between psychosocial and dental onset is that dental anxiety and fear create a circle of consequences. The dental team helps treat the problem, overcomes barriers, gains trust, well-being, and a healthy smile. Embarrassment is a dental anxiety which manifests from social anxiety such that qualitative characteristics differ by intensity in years of neglect, and that could be like 47% of the patients felt powerless, shame. The dental clinician needs to be sensitive to psychosocial nature and care to treat and prevent mental and dental trauma. The brain under anxiety tells the HPA to respond to stress by secretion of cortisol, which releases inflammation proteins. And the cortisol hormone forms glucose, which alters an inflammatory response. Oral health is related to environmental and genetic factors such that the cortisol levels may be measured by a saliva test, which in early childhood relates to late life inflammation and disease. Moderate to severe periodontitis is associated with bone loss and inflammation. This cross-sectional study shows quantitative psychoneuroimmunologic factors associated with periodontal inflammation, cortisol, and anxiety. Therefore, patients need more care and support. And the picture here shows the kidneys. A link for other pathways when we lower inflammation is to exercise. The role in age, there are current barriers. There's no funds or equipment for the older aged patient. There is new allied personnel where they would go to an on-site at like a recall visit, and then off-site the dentist could be in the office and reviewing the records that are emailed over. And the allied personnel would help with prevention, and if the patient needed treatment, then they'd be brought into the office to treat disease. The oral health care barriers show lack of funds and equipment, and the future virtual dental home will help all this for the patient to relax, exercise, lower anxiety, molecular inflammation, and increase overall dental health through mind-body connect. A smile is free and easy to age. Do you have any questions? Thank you.